Hi, I'm Dr. Teresa Green from Aligned Chiropractic in Richmond, Virginia. A lot of my patients come in with neck or low back pain, and one of the common findings amongst those types of patients is that they have weak spinal stabilizers. The group I want to talk about in particular is called the multifidus muscle. There are entire books on this muscle group and how important it is to spinal stabilization. But to give you an idea, this image shows you the multifidus muscle group in the lumbar spine, and what you can see here is that it's a really tiny muscle that goes from the mammillary process or the transverse process higher up in the spine to the spinous process. And it's about as thick as my pinky, but it is your first line of defense in stabilizing vertebral motion. What I have behind me here is what I will see commonly when we look at MRIs on our patients, is that we can actually see the weakness in that muscle. So this is usually not in the report. So if you've just read the report, you may not know about this because it's often not even commented on in the reports. But to give you an idea of what you're looking at here, if you're not an expert on MRIs, we are looking at that multifidus group, which is right next to the spinous process in your back. And so what this is showing here is a grade 0 fatty infiltration of the multifidus muscle. And you're seeing here, this is a nice red tissue that is healthy. As we progress over here, you see a lot more white, and white in this image right next to that spinous process is fat. So the fat has infiltrated that multifidus muscle here, and over here you can see this really nice marbling of the multifidus muscle, which is saying there's a whole lot of fat in that muscle. And one thing we know is that muscle fat does not contract, it does not stabilize anything. So if that is your first line of defense right next to that spinous process, then you don't have a lot of stabilizing. So on the actual spine here, you can see this is a very similar image to what I showed you before, where this is the spine, hips, and you can see that the rubber band is representing the multifidus muscle, and again, you can see it goes from the mammillary process to the spinous process. So what I've found that works best for patients who have low back or neck pain and have weak stabilizers is that, first of all, we need to restore normal joint function. If you don't have normal joint function, anything that attaches to that joint is going to be altered in its mechanics. So you've got to restore that normal joint function. With chiropractic adjustments, we do that. The second step is once the person is out of the pain zone and ready to rehab and strengthen and build endurance in those muscles, we start with some stabilizing exercises. And I have found that sustained contractions are critical to targeting this muscle group and building its endurance and taking it from the marbled fat appearance you see here to that more healthy tissue over here. So on our website, I have some videos of me showing you how to go through what I call the swimmer's progression. And if you click here, you will see those videos. On another link on our website, we have a next level of exercises, and if you click here, you will see those videos and what you can do at the gym. My personal favorite, because it's so impactful in rebuilding and restoring your posture, is the head weight device. And if you click here, you will see some videos on the head weights. Finally, we have a special device we have here in our office and that you can also take home called the wobble chair. And the wobble chair helps to restore joint function into the lumbar spine, but works all the way up through the neck. And it helps to build proprioception and balance and core strength and all these little tiny stabilizers. And if you click here, you can see some information on the wobble chair. But our goal here at Aligned Chiropractic is to get you back to doing whatever activities you prefer and to get you from having recurrent episodes that happen all the time for no real good reason to being healthy and being able to do everything you want to do with your body. But I hope you have a wonderful day here in Richmond, Virginia.